Hello, Bogotá.
Hello, how you doing? Hi, bestie.
Hi, Bestie. How are you doing?
I'm good. How are you
It's the
doing?
second day we are meeting again today. Are you bored with me?
No, not
Okay,
yet.
thank you,
Never.
because I'm not. Everyone, this is the Besties Briefing by FP2030 for the Met Possible campaign. And this is the FP2030's community campaign to change the narrative around family planning and spark new conversation with new partners. And I'm Dina Chaerani.
And I'm Bea, and I work with Power to Youth.
Exactly. And we are here as the co-host of Besties Briefing. As you know, yesterday we already have two people, amazing people, the commitment maker from FP2030. Now, as you can see, there are another amazing organization representative, which is DKT and
ICM.
Yay! Give a round of applause. So, I'm gonna now ask to DKT first, B. And we are here accompanied by Josephine. Josephine, could you please introduce yourself first?
Sure, thank you. Thank you for having me. Good morning from Bogotá and at the ICFP 2025. I'm Josephine Ngo Mawoh, and I'm the regional director for DKT in the DRC, Republic of Congo, Burundi, and Central African Republic. As you know, maybe DKT, we are a service provider of family planning, contraceptive delivery services. We are present across almost 100 countries in the world, mainly the low and medium income countries. We are recognized for our strong marketing activities, social marketing activities. That means we use commercial marketing techniques because we have marketing people who are very expert internally to educate about contraceptive, HIV prevention, and also safe abortion. We work mainly with family planning products that are easy to find, easy to understand, and also affordable. We also train healthcare professionals to attend the young people without judgment, without taboo, and without stigma.
Okay, thank you so much, Josephine. I feel like you already sort of tap onto the questions that we're gonna ask about what commitment that you are gonna say in here. So probably give us a little bit information about what is your FP2030 commitment, because you already mentioned it a little bit.
Okay, so I will start with that second question. Yes, that's okay. So with regard to the 2020 commitment, we are hoping to achieve a little bit more than what we have started 2 years ago. For me, when it comes to the FP 2030 commitment, my dream is simple. Every woman, every girl, every boy should know what family planning is about, how to access it, and where to get advice. So we want to make family planning normal, no taboo, no secret. When it comes to DKT, we are thrilled to announce, and our CEO has announced earlier, that DKT is committed to double his FP 2020 commitment to about $2 billion. And you will ask me how we will get there, how we will do that. We'll be doing that by investing. We invest on mass media, we invest on digital, we invest on social media to make sure that we inform as many young people as possible. We educate them, we help them on a change behavior. We also will be investing on healthcare professional trainings so that they can accept, they can support the young people when it comes to family planning, and also about product supply. We are one of the largest commodity supply when it comes to family planning, and this is how we are committed for FP 2030. Yeah.
Period. We love that. Money is important to driving the changes as well. Go, Bea.
Absolutely. Thank you so much, Josephine. And now I want to bring it a little more personal to you. So in your own life, what has been made possible because you had access to family planning?
Thank you for this question. I really love that question. Family planning changed my life very early, maybe even without knowing that it's called family planning. When I was young, I had choice and I had big dreams. I could finish school, I could go to university, I could get a job and become financially independent, help my family and also women and people around me. Because I had access to contraception, because I take contraception myself, I decided when I would become a mother. So when the time was right, I had my girl, my child, and I decided to give her the best education, the best care, and also the freedom for her also to access, to have her own dream. And this is also what is happening today. So family planning for me is very powerful. It gives every girl, every woman the right to choose for her future. And family planning opens doors to education, to success, opportunity, as well as freedom.
Absolutely. The benefit of family planning cannot be understated. So thank you so much for sharing your perspectives, Josephine.
Thank you, Josephine. Now we are going to move on to our amazing Steph. I feel like I'm now the bestie of ICM. Last night I was literally interviewing Merit, and then now you. So we talked already about DKT. Now we want to move on from the perspective of midwives, right? We already heard about like why it's important, like midwives also participating in the family planning. So from your perspective as an amazing midwife, how has access to family planning shaped your practice and care you provide?
Thanks, Dina. And thank you for having us here today. I'm Steph from the International Confederation of Midwives. So I guess a starting point is that we address the myth that midwives just do maternity care, just catch babies. This is not true. Midwives can provide 90% of sexual reproductive health, and this includes contraception and includes comprehensive abortion care. So as a midwife, when I have the skills and tools, I can provide family planning to women and couples so that they can make choices, they're autonomous, and they're free from the shame and discrimination of STIs, unwanted pregnancies, and that they can choose if, when, and how many children that they have. And this ensures that we have healthy families that are physically and emotionally thriving. And we know that midwives are the best people to provide this care. So in a midwifery model of care, we've got relationships that are based on trust, that are underpinned by rights-based care, and midwives are also community-based, so that means that family planning is accessible, that family planning is in the community where the women, girls, and families that need family planning are.
All
right.
Move on.
Thank you so much for sharing your perspectives. It's really great to hear about all the incredible work that you're doing to revolutionize women-centered care. So now I really want to talk about your FP2030 commitment. So what are you hoping to achieve and how will you get there?
And tell us, what is that? The side petition. It's important.
Down here.
Dina, that's a spoiler. So thank you for having ICM as an FP 2030 commitment maker. And ICM want all women, girls, and gender diverse people to have access to sexual and reproductive health and rights. These need to be met by an educated, regulated, equipped midwife who is enabled to work to her full scope of practice, or their full scope of practice, which includes family planning and comprehensive abortion care. But to make this a reality, we need 1 million more midwives, which, as Dina spoiled, is the sign down here. So ICM have a petition at the moment called 1 million more midwives. If you can sign today, that would be great, and share. And we're trying to collect 1 million signatures that can be used by countries and midwifery associations to take to their national governments, health policy leads, to encourage investment for 1 million more midwives, so women and girls can have access to a midwife, providing family planning along with all the other services.
Incredible. Thank you so much. You heard it right from Steph. We need 1 million more midwives. So please sign the petition.
Scan
down
now.
Here. Scan the code.
Follow
right
also
this
the
minute.
account. Follow the Instagram, right? Push
Yes.
campaign org. Oh
Yeah,
my
they
God.
have incredible stuff going on social media.
Amazing. So Bestie, I think it's quite important, you know, the discussion between like DKT is really literally committing into like giving more funding so that like more young people also have the access to the family planning, and then now also the midwives telling that this is important to also working together with the young people, right?
Absolutely.
And then show more myth busting about the midwives. So I think it's super important having all those things too. So yeah, you want to say something?
No, just thank you. And I just want to again quote something that our CEO, Chris Purdy, has said earlier: to trust women to do what is needed to make their life better. Trust women to do what is needed to make their life better. So for me, it's really powerful.
Amazing. Thank you so much, everybody, for watching us, me and Bea at the Besties Briefing. Thank you so much, Josephine and Steph.
Thank you.
Please give a round of applause for this FP2030 Commitment Maker. See you in the next year at ICFP Besties Briefing.
Bye.